at the Ministry of Health and Wellness, and Dr. Nadine Williams, the Director of Health Systems Integration and Planning. We'll begin with the update from the Minister.
Okay, thank you very much, Stephen, and thank you to my colleagues who are here, who have been working tirelessly at the COVID response. Thank you for coming out at short notice, having taken the decision, having had a discussion with the core team that we needed to report to the public on the COVID updates. First of all, I want to thank also the members of the media for joining us, and we, of course, will, in the usual style, entertain questions after we give the update. Last year proved to be one of the most challenging years as a country, and especially for us in public health, certainly also for the entire country. I want to use the opportunity firstly to wish all a happy and prosperous new year, and certainly from a public health perspective that 2021 will be a much less challenging year than 2020 was, certainly as it relates to the COVID pandemic, the COVID threat that we have had to confront, but generally speaking, as it relates to the health and wellness of the population. I want to also use the opportunity to thank our public health workers who have really given the best of themselves well beyond the call of duty over the past year. And I really want to salute them because they are our heroes of 2020. And they have made a significant contribution to protecting the population. Beyond that, though, I want to recognize, again, from public health, the contribution of so many others. The Honorable Prime Minister, who has led the charge from the front, the cabinet, private sector leaders, other frontline workers, the police and others, and also, very importantly, members of the public, who for the most part have complied with the requirements, with the advisories, and as a consequence, I think we have done better than many because of overall general compliance. The COVID-19 challenge, however, continues in 2021, and we thought it was necessary to give a quick update, or should I say an early update, today being the 2nd of January for the year 2021. There are many lessons learned, and we are assessing all the strategies that we have pursued over the last year. Many of us use the holiday period to reflect and to take those lessons that have been learned and hopefully will enable us to respond in a more effective way in the year 2021. Unfortunately, many of the leaders, the champions on the front line or providing strategic guidance have been affected by the pandemic. And I want to use the opportunity on behalf of the team and indeed the entire country to recognize and to salute Mr. Tyrone Robinson, who served as chairman of the Northeast Regional Health Authority from 2016 until his untimely and unfortunate passing last evening in the US, a victim of the COVID pandemic or complications from COVID. We have benefited tremendously from his leadership and his passion for service. He was very passionate about improving the infrastructure and the aesthetics of our health facilities, used every opportunity to mobilize his strong networking skills and knowledge to garner advocacy and assistance from all sectors of society to advance work in the Northeast region. And again, I say on behalf of the team here, we certainly express our condolences to his family, to his friends, to the NERA team who he worked with, the board members of NERA. I want to say personally from my heart, Tyrone was someone I depended on, who gave advice, gave good counsel, and was a hands-on chairman. He went out and he not only spoke what needed to be done, but he helped to get it done. And I could always depend on him both in his capacity as chairman, but also as a friend. And this is really a hard-hitting scenario for us in public health, and I'm sure for all his friends and his family members. May his soul rest in peace, and we will continue to pray for God to give guidance to those he touched and who have depended on him to date. The COVID-19 update for Saturday, January 1st, 2021, we felt was not commenting on. January 2nd, 2021, sorry. The Ministry of Health and Wellness can report that today we have 118 positive cases from a sample tested of 513, and that's in the last 24 hours. This is a positivity rate of 23%, and it represents the highest positivity rate over the past 8 weeks. And of course, this is very concerning to us. You will recall that based on the assessment of public health and as a result of the increased movement in the population due to international travel and the celebrations for the Yuletide season, there is an anticipation, as we had said, of a spike in the number of cases for the month of January. While it is early days yet, the trends are showing an uptick in the number of cases being reported, especially, and this is something we said just prior to Christmas, but especially in the western end of the island. As we have announced, we will get back to this because the Chief Medical Officer will give better particulars, but we are concerned and continue to be concerned about certain parishes. Westmoreland, of course, was one of the key parishes that we spoke about, and there were added restrictions there, but there are others, and it is a matter that we have to monitor carefully and act appropriately in order to cauterize the situation. In terms of the restrictions around the UK, we thought it was important to give an early update to the public. As we had announced, 20 samples from persons who returned to the island from the UK on December 28 were positive, and that those samples would be sent to CARFA for further evaluation. The ministry can now confirm that 4 positive samples are of the new strain, the variant strain, which led to the restrictions in the first place. So those were tested. The Public Health Agency of the region, CARFA, got the samples, and 4 so far have been confirmed positive of the new strain. Of the samples submitted to CARFA, 6 met the criteria for genetic sequencing based on the viral load contained in the sample, and from those, 4 were found to be the variant strain. Again, the Chief Medical Officer and the other technical members can elaborate more on that. It is to be noted, however, that through the actions of the government following on the recommendations from Public Health, that we were able to quarantine and test those passengers on the UK flight. I believe that was reported. As a result, the 20 positive cases were isolated in a government-approved facility, and based on home assessment completed, some were allowed to isolate at home. As at today, the report is that they all remain stable and are asymptomatic. Those who returned a negative result were fitted with monitoring armbands and transferred to home quarantine. The reports from the health department have indicated that as of today, they all remain asymptomatic. Barring the development of any symptoms over the next 3 days, those in isolation will be deemed as recovered, and the intention is to release those individuals. The persons in home quarantine will be also released by the parish health authorities. As it relates to this strain of COVID-19, I want to say to the public that there is no evidence to confirm that the strain causes a more severe illness or affects the efficacy of the current approved vaccine. The key is to follow the advice of the Public Health Authority, and that is worth repeating. We are monitoring what is happening in the UK, in other jurisdictions. The technical team continuously gets updates. They examine the information that comes out of those jurisdictions. They continuously keep in touch with the World Health Organization and PAHO. And as of now, as said earlier, there's no evidence to confirm that this makes you more ill or it affects the initiatives that are now in progress towards having a vaccine. And that's positive. That's a positive piece of information. However, we cannot be complacent. We have to ensure that we abide by and observe these protocols that have been established and we talk about every day. Based on this evaluation and in consultation with the Prime Minister, who I spoke to at length today, and the Cabinet, or members of the Cabinet, an extension of the travel restriction has been issued, as was announced, to January 31st, 2021. This is, of course, read the UK. This is in an effort to provide the public health with an opportunity to gather more information on the implications of this new strain, as well as to assess the country's capacity to treat with the challenges that may arise. So we are monitoring, we are learning as we go along. To date, the evidence is not so damning that one should feel more threatened, except, of course, that it spreads more rapidly. And we will have to continue to learn as we go along, because as we have said, this is a novel virus, it's new, and the world is learning as it goes along. But one thing we can reassure the public with is that if you follow the protocols, then you are also providing some protection to yourself. We cannot underscore, therefore, enough the importance of members of the public adhering to these protocols that they have been put in place to reduce the spread of the virus. Jamaica, finally, remains in community transmission. And of course, that means that the virus is everywhere. And so one cannot take anything for granted. Every Jamaican has a responsibility to cooperate with the government, to take personal responsibility to protect themselves, their loved ones, their communities, and the country by observing all the infection prevention and control protocols, including the physical distancing of 6 feet, staying at home and avoiding crowds unless you have to go out, frequently washing and sanitizing hands and cleaning of surfaces, wearing of masks, very important. I want to thank those who have responded to the Mask Up Before You Talk Up campaign, obeying quarantine and isolation orders as given by the public health authorities, and adhering to the provisions under the Disaster Risk Management Act. It is very important, ladies and gentlemen, that those protocols are observed. As we confront 2021, there's still a lot of work to be done, but I think that we have learned a lot from 2020, and I think the team is ready to take on the challenge until we can come to a resolution. At this time, I'm going to invite the Chief Medical Officer, Dr. Jacqueline Bisesa-McKenzie, to provide us with the latest on surveillance. Dr. Bisesa-McKenzie.
Hi, good evening, everyone, and a happy new year to everyone, and in particular our healthcare workers and the rest of the population. We're going to move to our slides. Okay, so our situation update is up to the 1st of January, which was yesterday. So we had 12,931 confirmed cases, of which 572 were imported cases. 12,359 were locally acquired cases. For the last 14 days, from December the 18th to January the 1st, we would have had 523 confirmed cases. If you look at the map at the bottom of the screen, you can see the parishes that are darker, where we have the most cases, and still Kingston and St. Andrew and St. Catherine, we have the highest number of cases, but then also in terms of the north and the western parishes, we are also seeing increased numbers, St. James and St. Anne in particular, and of course Westmoreland. We continue to monitor Westmoreland because we have seen an increase in the number of cases over time, and in particular, the number of cases per population is greatest in Westmoreland. Next slide. So this is our new rates in terms of the rates by parish, and we can see again the northwestern parishes. Just want to add that for today, Minister had already said that we had 118 new cases today out of a total of 513 samples. So this would add to these cases, and particularly in the parishes of St. Anne and St. Thomas, that is where we had most of those new cases. Next slide. In terms of active cases, 1,792 cases. Just want to mention again that this number is a little bit different from the cases over the last 14 days. We would have had less cases over the last 14 days, but some cases remain active because we have not been able to contact some of these persons to get them off our listing so that they can be discharged. So some of them are actually mentioned as active cases, but as I had said earlier, we have 520 odd cases that would have been confirmed over the last 14 days. We have 303 deaths, 49 what we call coincidental deaths, which are where persons would have died who would have been COVID positive, but there was another cause for the death. We have 24 cases that are still under investigation. Just a reminder again that we do have to look carefully at these cases in order to be able to categorize them in one class or the other, whether they are actually COVID deaths or coincidental deaths. Next slide. This is what our epidemiological curve looks like. And again, we can see that starting at the end of November, we would have started to go up in terms of the number of cases. Right now, for the period between the 20th of December to now, we are seeing a slight decrease in the number of cases. However, this is very, very early to say that there is any kind of decrease there, because even when we add today's numbers onto this slide, which was as of the 1st of January, we would start to see an increase again in the number of cases. So that decrease there now, we have to watch that very carefully because that will change. Particularly in our western parishes, as we had mentioned. On the left side of the screen, we can see that Westmoreland, our peak is still rising on that side of the island, and we can also see in Hanover that we have an increased number of cases. Essentially, it looks busier on the right-hand side of the graph for those parishes. And then we can look at St. Anne, where we can see that we certainly are seeing an increased number of cases. And in the southern parishes, in Manchester and in St. Elizabeth, we're also seeing an increase in the number of cases. So generally, it is showing that despite the fact that we may be seeing a decreased number right now, that our trend is still going up in most of our parishes. We've had a total of 139,367 tests performed up to the 1st of January, with an overall positivity rate of 9.3%. And this is what our weekly positivity rate looks like. We had petered around the between 9 and 10. As I said, last week, the positivity rate was 9.9%, and so far for this week it is at 8.9%. And this is the communities that are affected across the island, where we have active cases over the last 2 weeks for the period December the 18th to January the 1st. Again, we can see how busy Westmoreland is, at a parish that we're having a lot of focus on, but we can see St. Anne as well is also having a lot of pink there, because a lot more communities are being affected in St. Anne. Again, we can see that St. Catherine and Kingston and St. Andrew are parishes that we've constantly had a number of communities that are being affected, but where we're seeing the rise right now still remains in the northwestern side of the island. And these are where the communities, these are the listing of the communities, and We've always given you a picture of the top 20 communities with active cases, and this is very important for us in terms of our activities as a ministry, because right across the country, our parishes, the medical officers of health who lead the team there, are actively conducting surveillance in these parishes once we see them get into the top 20 listing. So community activities will be carried out, and we're asking the population to cooperate with the members of the team to test where you can be tested so we can know if there's any additional spread in these communities. Our aim is to get these communities' numbers down. And so where you see St. Catherine, we're having quite a number of communities in St. Catherine, 4 communities in St. Catherine that are on this list. We can also see Manchester, where we have 2 communities, and we see Westmoreland there as well, and St. Anne. St. Mary as well is also showing up with a number of cases. So these communities, if you live in these communities, you need to be aware that you have active cases in these communities, and it is even more important that you adhere to all the prevention measures that there are. This is where our graph showing the number of deaths, and as you can see, at Epi Week 46, we would have started to see an increase in the number of cases in terms of deaths. But right now we're seeing as a decrease, and we continue to watch this because we know that the severity of the illness tends to lag behind when the case is confirmed. And of course, outcomes of the severity of severe illness can be poor, can result in deaths. Next. And this is just to give us a summary in terms of our hospitals. As we can see that we have across the region, we have 2 hospitals, a few hospitals that in terms of their general capacity, we are over 84% capacity. And this gives us an idea of how our parishes are managing in terms of the cases, the COVID cases, and how the hospitals are able to stand up to the pressure. So this is something that we continue to monitor, and we can see that Falmouth Hospital, Spanish Town Hospital, Linseed Hospital are over 84% capacity, and therefore in what we call the red zone, and these are hospitals that we watch very carefully. And then we see that other hospitals are threatening to be there, and we look at KPH, Savlamar Hospital. In terms of isolation capacity, we would see that Noel Holmes Hospital, Falmouth Hospital, again in the western side of the island, they are over their isolation capacity for COVID cases. Next slide. And in terms of case management, just to give you an overall picture again in terms of where our cases are, just want to show that 47% is where our overall occupancy in terms of our COVID beds, where we have 174 beds being occupied out of a total of 370 beds. The majority of these are in the western region, and you would see that in the western region is where we would see more of our moderately ill, severely ill, and critically ill cases. That's where I'm going to end our presentation.
Thank you, Sebo. Can you put back the slide about overcapacity? I think they're about 2 slides back, 2 or 3 slides back. Are you able to do that? No. Back to the 2 or 3 slides back. No. Forward. Or go. Continue. No, man, you're not going forward. Anyway, I wanted to, while you're doing that, let me just say, I think the point, this is the one, I think the point about overcapacity is a very important point to reemphasize, CMO. And I really want you to help the public to appreciate what this means, because the entire process around the public health response to COVID has been to not allow the public health system to become overwhelmed. Right. And we've been working at this. This has been our core, at the core of everything that we do. And to the extent that we are now seeing signs of that is cause for elaboration and for emphasis on why it is important. So I'd love you to comment a little bit on that.
Right. So actually, Minister, at this time, we are looking a little bit better than we did over the last 2 to 3 weeks in terms of capacity. What we would have seen, we would have pointed out that we continued the restriction in Westmoreland, because not only was the hospital in Westmoreland, Savlamar Hospital, its general capacity was quite high, as well as its isolation capacity, but also the other hospitals within the Western region were also coming under pressure. And so that was one of the reasons that we had given why it was justifiable to continue the restrictions in Westmoreland. Mm-hmm. So this is something that we continuously monitor, so that we can find, as soon as the hospitals enter that red zone, which is above 85% capacity, we can start to look at interventions to try to manage that situation, to prevent an overwhelming of the system.
Thank you. And I spent a few days in Westmoreland, and we actually donated some masks to the political leadership on the ground and to the hospital as part of the public awareness and support program. And I think it's still important to just emphasize that if we get to a stage where the hospital cannot handle symptomatic cases that require hospital treatment, the next best thing is to move around persons by shifting to other hospitals. But assuming challenge is there, then we become almost, impotent, if you will, to provide the level of hospital care that will be needed for those persons who are the most severe. And we just cannot allow this to happen. So I say again to the people of Westmoreland and Western Jamaica generally, St. Anne is certainly featuring prominent in the numbers, that we need to appreciate the consequences of the numbers and the impact on the public health system, because everything is geared towards being able to cope. We know COVID is here and it will be here for some time, but we want to be able to treat those who need treatment. And the more you expose yourself, is the greater the risk of us not being able to respond in the most efficient way. Thank you for that. So CMO, thank you for that presentation. And I think, unless you want to add anything, we will go straight into the question and answer segment. Stephen, over to you.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose your questions to the panel. We're going to begin with Janet Silvera from The Gleaner.
Thank you. Happy New Year to you all. Thank you. I have two questions. One is in relation to the field hospital. Where are we with that, owing to the fact that hospitals are now near to capacity, some of them? 1, 2, vaccine. Where are we with vaccine? How soon should we expect to start vaccinating our people? And will we have to pay for the vaccine, we as citizens of the country?
Let me ask you. You weren't finished. Go ahead, Janet.
Okay, right. I was wondering if it's the citizens who will have to pay, because I know we had said some time ago that the government would be giving it for free. I can recall hearing that some time ago.
All right, so let me ask the PS to comment on the field hospital. I have an idea, but he is the one coordinating those activities, and then maybe the CMO can comment on the vaccine.
Yeah. Thank you very much, Minister. Good afternoon, everyone, and Happy New Year to you, Minister, my colleagues, CMO, and the nation in general. The field hospital is now slated to be completed by the end of January 31st. We had significant delays because of the rain and the weather, both Falmouth and St. Joseph. Both field hospitals had significant delays because of the weather and because of the nature of the material and the work that was being done. We were not able to proceed on the implementation until the weather changed. And so we are very certain, we have been given assurances, barring force majeure, that we will be able to complete by the end of January 3rd.
Thank you.
So we would have already have said for the vaccines when they would become available, but let me just a reminder. What we have heard that by the second quarter of the calendar year, that we would be receiving the first set of vaccines under the COVAX facility. And this has increased. Initially, it was 1% that we would receive in the second quarter, but this has now increased to 5%. And what you would find is that as more vaccines are approved, more manufacturing occurs, that the numbers may change. But overall, through the COVAX facility, through this first phase, and I just want to reemphasize that this is a first phase, that 16% of the population will be vaccinated. We expect that within the second quarter of 2021 is when we will receive the first set of those vaccines.
If I may, just to add quickly to that, in the coming weeks, we will begin to sensitize the population with better particulars around the vaccines, the availability, the nature of the vaccine. Hopefully we'll address some of the queries or concerns that persons have. There are a number of attempts at creating a vaccine. I think the last report I saw was 150, but just over 50 that are being monitored by the World Health Organization / PAHO. We depend as a small island state on the expert committees that are vested in these entities to give us the type of technical support that is required to ensure that whatever vaccine we sign off on and access, it is safe for the public. And so, we work with PAHO, WHO, and the trials that are taking place, the approvals that are on hand, are based on those expert opinion, based on the assessment of clinical trials and so on. In other cases, where other countries are pursuing vaccines, we're not suggesting that those aren't worthy efforts. It's just that we are better off working within that community where those experts are available. And things are dynamic, so things will change, and we will take advice as the advice becomes available.
Just to add, Minister, I just want to reassure the public that, there are several vaccines that are being manufactured now, and as 2021 continues, we will find that more vaccines will become approved and will become available. These vaccines have gone through a rigorous process of development, and the process of development did not necessarily start during this year. A lot of persons are concerned about the time period to say that this was rushed, and because it was rushed and we had rushed approval of these vaccines, then we would have compromised on safety and on efficacy. The development of vaccines, yes, it's something that usually takes a long period of time, but I want you to really appreciate the concentration of resources that have been put in the development of these vaccines over the last year. And pretty much what you would have had done is several years' work that have been carried out in a short period because of the concentration of resources that have been put in there. But also, the modality of these vaccines, in terms of the new vaccines like the RNA vaccines, that is something that has been investigated over time. It is not just now. It has not just appeared on the streets. It is something that people have been working on. A lot of research has been going on for years, because the other coronaviruses, the MERS-CoV and the SARS-CoV that we had previously, that created major public health problems, and still the MERS-CoV is creating problems in some parts of the world. efforts have been made for years in terms of the development of those vaccines for these coronaviruses. So what you see now is a culmination of those efforts. So I want to reassure the public that once the vaccines have been approved and they have been investigated and we have seen the results of the trials, that once they are approved for use in Jamaica, you're going to have a safe vaccine that is effective, and we want to really put our confidence in that because it is very, very important that especially our vulnerable population be vaccinated as quick as we can get the vaccines here. We want to ensure that all persons over the age of 60 are vaccinated. Now, we may not be able to get beyond the first 16% for this year, but the fact is that if the vulnerable persons are protected, then it decreases the risk because we know that a lot of other persons will become infected. But what we're worried about are those persons that are going to become ill and can have a severe illness. So let us try to protect those persons first. And this is what we want to achieve this year.
Just to add to the question about the cost, the vaccine that we're sourcing through the COVAX facility is free to those who it will be administered to. And so it's free to the public. But as the CMO said, there's a priority list around vulnerable groups, and frontline workers are included in that, persons of a certain age with comorbidities. I suspect, frankly speaking, that things will change as we see more vaccines coming online. This is why I say persons have their views, and you may see me looking down on my phone while we're having the session because I get questions, and I think it's important just to respond to those questions. Persons are asking about private facilities for the vaccine and, why not go to countries that are not in the group of WHO, PAHO, and you're gonna see and hear a lot of comments around vaccines, and part of the thrust going forward over the next weeks into months is going to be to try to, as best as possible, clarify all of that and get the public to understand exactly where we are as it relates to the vaccines. And so please be patient with us. We're working on that.
All right, Damien Mitchell had a follow-up regarding vaccine as well. If we would look to China, who now has an approved.
I hope I answered the question when I spoke earlier, which is that there are some countries that we depend on the expert group within PAHO and WHO to monitor and to approve, and that's the COVAX program. There are other countries that are doing it, are having several attempts. Let's be specific. Cuba is a country that we work very closely with as it relates to public health. We depend on the Cubans, the Cuban government, the Cuban people to send personnel here. I think when COVID was announced, we had 150? Yeah. 150 additional support. We have probably 400 plus Cubans now on the island. And we cherish that relationship. Now, Cuba has been doing vaccine trials or doing research towards a vaccine. My understanding, CMO, you can comment on it, that 2 of these trials are part of the 50 plus that are now being examined and will have to be subjected to a process and signed off on. And we are a part of that process. So it's not a bilateral arrangement as it relates to this particular scenario. It's a process of countries coming together collectively, using the expertise that is available, assessing the trials to ensure safety, and then based on that validation process, those vaccines are then given the seal of approval and are produced for usage. It is no reflection on the quality of the work that those countries are doing, the strength of the relationship that we have with those countries. China, same thing. It really is that we have a process that we go through. That process acts in the best interest of the population in terms of health and wellness and safety. And we depend on that process, not just in this case, but in all our many other cases of this nature. And so that's why we are with the COVAX program, and will remain there at least for the time being. I don't know if you want to elaborate more on it, but just to answer Damian's question.
About China?
What about China, right?
I think that both China and Cuba have more than one vaccines that have been in trials, and we know that for the Cuban vaccines there are 2 that are in trials now, and so we await the conclusion of those trials. For China, I believe that China has more than 2 vaccines that are in trials, and I think recently there was approval of one of those vaccines in China. So we continue to monitor that situation because some of the vaccines from China are included in the COVAX facility and are being monitored. So we expect that, as I said, Minister, within the first quarter of this year, we are going to see several of the vaccines that are in development stage come out of that stage and are become approved. So we await that, and I am sure that once it becomes available to countries right across the world, we're going to have several vaccines that are going to make up what is available.
Right, thank you very much. We're going to go to Christopher Thomas from the Gleaner.
Good evening, Minister, and good evening to your representatives who are with you. Oh, you mentioned earlier on, you touched very briefly on the fact that 129 schools are scheduled for opening on Monday. But in light of these updates that we are receiving this evening, have you had or will you have any discussions with the Ministry of Education to determine what's the next step forward? What sort of extra safety measures may be needed to be put in place? And also, what do you have to say to parents at this time who are probably very concerned as to the increased risk, if any at all, that their children may be exposed to, especially in light of the update that we've gotten concerning these 4 particular positives that we have now confirmed?
Okay, so the answer to your question is we are in dialogue and ongoing dialogue with the Ministry of Education. In fact, just prior to coming on this press brief, I had a phone conversation with the Minister of Education, Minister Williams, and she is going to be doing a statement to the country around face-to-face classes and schools reopening in general. I'm going to leave her to make those announcements, but suffice to say that the team has been very actively involved, the public health team. There was a meeting as late, I'm told, as was it this past week here, where the CMO was present in that meeting. And we're giving all the advice that is necessary, including bearing in mind the recent developments. It's a very difficult call, but the truth is we have to find a way to restore some level of normality, even with the new norm that exists around infection prevention and control. Our students are there. They've been out of face-to-face arrangements for the better part of 2020. There have been implications for that, mental health, a number of other implications, access to greater clarity and understanding, and it is challenging. Having said that, it's really about the balance. And I think the government, the Prime Minister, the Cabinet, and certainly the 2 ministers, myself and Minister Williams, are very seized with the need to be extra cautious. Now, and she will therefore give you the specifics around schools. On the issue of parents, I guess the advice is no different from what we have been giving. Parents must recognize that the COVID is around, it's everywhere. The community transmission is still there, and they should take the extra precaution to the extent that their children are going out or will go out, in terms of the masks wearing, the sanitizing, giving them the advice around the distancing to the extent that they can social distance. And, there are some protocols too as it relates to those children coming home in terms of how they, change their clothing, where they, place it, their shoes, when they take it off, wear that sort of thing. So there are protocols there that the Ministry of Education in collaboration with the Ministry of Health will provide to ensure that the information is there. What we ask is that we follow the protocols. Thank you.
Thank you very much, Minister. We're going to go to Emma Lewis.
Hi, good evening and Happy New Year, everyone. I had a question about testing. I noticed that the numbers being tested were pretty low for about the last few days, and I wondered if there is a reason for this. Are we fully up to scratch with equipment and testing machines and so on, or were there some other reasons? Thanks.
Right. Well, Emma, thank you for that question and for giving me the opportunity to elaborate on this. The testing over the last couple of days the numbers would have gone down simply because we get samples coming from our hospital surveillance as well as our community surveillance and in terms of case management. So what you would have found that over the last couple of days, the number of community surveillances that were done would have been decreased because of the season, one that we are in. Not many persons would tolerate at this time the invasion of their communities in terms of doing community surveillance at this time. So we did have a few days that we decreased the number of community activities that were being done. But we continued with our hospital surveillance and our case management samples. So you will find that as of next week, all the parishes have their surveillance activities planned, and we expect to see the medical officers of health leading their teams into all the communities that, especially you see the top 20 communities. So we really do expect that the numbers will go up again. But I also just want to say that we, as a country, we face the same challenges as other countries in terms of reagents, getting a steady supply. And so there are times that we are going to fall short. Right now, we do have a difficulty. We're awaiting some materials for our open PCR testing at the National Public Health Lab, and we're relying heavily in terms of the numbers that you're seeing on the National Influenza Center. However, we do expect we are going to be getting COBAS kits next week, so we expect that from the closed PCR system at NPHL that will be up. But I can tell you that we do suffer from supply issues, and so from time to time we are challenged in terms of providing a continuous, reliable number of tests.
Thank you very much, CMO. I'm going to go to Cassius Watson from Jamaica Social.
Can you hear me?
Yes, go ahead, please.
Okay. Happy New Year and good evening to all the panelists and all those viewing this live coverage. I have 3 questions. Any indication, Minister, from what you've heard or what you know regarding Mr. Robinson's contraction of the virus? Was it a situation where he went to the US for treatment, or a situation where he was there and contracted the virus, as far as you know, as far as you've learned? That's one question. The second question is regarding any word, can we get an update on Twickenham Park, the police academy? How are things there now? What are the numbers like, or have things stabilized? Any details there? And lastly, any further testing beyond, or any further testing for the new strain of COVID-19, or is it that we are now confirmed that it's here, that's it? Will there be further testing to see, if other people are showing this strain. That's it. Thank you.
Okay, so in regards to your first question, sir, I have to decline to comment on that. I don't think I'm at liberty to give details around my colleague and friend and the circumstances that led to his unfortunate passing. That is a private matter, and I think it wouldn't be appropriate. Just as we have said, to express regret and condolences to his family, to his friends, and to his colleagues. On the issue of the Twickenham Park, you have any information there? Yes. I have not got any reports on it, so I suspect it's under control because I would get a report any.
Just 1 second.
All right, so we're checking on that. On the issue of testing and whether the virus is here, let me comment generally, and then the CMO maybe can follow up if necessary. We have no evidence to suggest that the virus, the new strain, is in the population. It could be, but we have no evidence to support that it is. We, I think, acted appropriately, as is now being demonstrated by the actions we took in regards to the quarantining of the plane that came in from the UK. And this was action taken as a result of the discussions that were there and the collaboration that we're a part of in monitoring the wider environment outside of Jamaica. And of course, we have had to depend not just on our own infrastructure here to test, where we picked up the positive cases, but of course on CARFA in Trinidad, our regional health body, to do the additional testing. So as of this point, those are the cases that we have. Again, the surveillance will determine in due course where we are. We have pushed back, as you know, the restrictions in terms of the flights from the UK to give us some time, as said earlier. And so I think the country will be kept up to date, as is customary in the days and weeks to come, as it relates to any changes in the approach. CMO?
Yes, with regards to Twickenham Park, we had the last 2 cases that were positive on the 19th, so they would actually finish their isolation period today, and that would complete the isolation for the 59 positive persons that we had in that cluster. So in terms of their activities, we expect that their activities would return to some normalcy, of course taking all the precautions that needs to be taken to ensure that we don't have a similar situation in the future. With regards to testing, continued testing, yes, we will continue to send samples to CARFA. We have already had discussions with CARFA in terms of the continued support that they provide, and I just want to recognize the tremendous support that we have gotten from CARFA, and they have really just jumped in right at the start in terms of this whole discussion on the UK variant and offered us this opportunity to have testing done for the genetic sequencing. They have committed to the CARICOM countries that they will continue to do weekly testing, and so we will continue to send. I think we have a batch of 20 samples or so that we are sending next week. Our main limitation in terms of sending the samples are in terms of direct flights to Trinidad. And as soon as we have some of those logistics in place, then we can be more reliable in terms of when the samples go off, because we were expecting that a batch would have gone last week Thursday, but then there was no flight, and then we expected Saturday again. We had taken the samples again, and there was no flight. So we're expecting that Monday we will send off the second batch of about 20 samples. We will be testing in that batch the rest of the UK positive samples, and also we are doing some back testing of samples that we had before that were positive, just to find out, to get an idea in terms of what's happening in the population. So we have not determined yet in terms of our sampling method going forward, but we will continue to send samples. And it's not important for us to test everybody to find out if the variant is, how much of the variant is here, but it is important that we continue to monitor the situation, so we will continue to do that.
Thank you very much, Minister. Those are all the questions that we have on Zoom, so I'll hand back to you for your closing remarks.
Okay, well, first of all, let me thank all of you who are here, GIS at very short notice for coming with the technical team and setting up to give us the opportunity to broadcast this COVID discussion, and the technical team who Steve introduced earlier. I want to thank them for being here and for participating and providing. What's that? Oh yeah, right. The technical team for the ongoing consultations. We've had a number of meetings this morning, starting at, what time was it? What time did I call you? 7 or somewhere around there, just to assess on an ongoing basis what is happening. We think that it's important to keep the country updated. And here's what my own thoughts are as it relates to this 2021. I mean, it has been a year, what a year I would say, in terms of the public health challenge that we have had to face as a people, as a country, and indeed as a world. Indeed, if you read the commentary, there's general consensus that we have not seen this in 100 years. And, you know, we have made strides in terms of learning lessons from it. We've made some mistakes and tried to correct those mistakes, but through it all, I really believe, as Minister of Health and Wellness and as a government, on behalf of the Honorable Prime Minister and the Cabinet and the team here, we have been able to, I think, provide information to the public, to be as transparent as possible, to mobilize, generally speaking, the stakeholder groups to respond. And while we absolutely regret the losses that we have encountered, the 300 plus lives, and all of those lives are equally important, and those who have had to incur hospitalization, we also have to recognize the gallant efforts of so many persons who have allowed so many of us to survive 2020. And, you know, we all as a country should pause and give thanks to the Supreme One for his guidance, his wisdom, which has been given to all of us to respond to this challenge in the way that we have responded. And I'm speaking now generally of the country, because I believe this has really been a national effort. Having said that, it is so important for us not to let down our guard, not to become complacent, not to lose focus. This is a marathon, it's not a sprint. A year is a long time to be so actively engaged. There's a lot of burnout and stress related to the efforts both of those who provide leadership and those who have been led. Quarantining at home for months when you're accustomed to going outside takes a lot of effort. So we appreciate those efforts. But I believe that there's a glimmer of hope, or even more than that, in the months to come, in that despite the new strain, despite the challenges of surges and spikes that are taking place, I think modern science and the world has come together, and there is light at the end of the tunnel. And that tunnel is fast approaching, or the end of that tunnel, with the vaccines that we hope will be out and available. We will continue to provide information on the progress of the vaccines, and I say vaccines plural because there are several attempts. I certainly believe that even though we commit to 16% of the population during the course of this year, there is likely to be more than that because of the progress that are being made as it relates to the vaccines. And we, I think, just need to obey the protocols around the masks, the social distancing, the staying indoors unless you have to go out, as part of the best and most foolproof approach to preventing the spread of the virus or further spread of the virus. I want to say that we are likely to see increased numbers in the weeks ahead. And this we had predicted, given what the season represents, given the expanded travels and the temptation to be around friends and family in an unusual or the usual way during this period. It's something that we have planned for. The team is prepared to deal with. The cabinet, the Prime Minister appreciates and will provide the leadership as appropriate. And so if you see those numbers going up, don't be alarmed, but be concerned. Respond by playing your part and doing what is necessary in order to minimize or to cauterize the process. We have capacity in our hospitals and we want to keep it that way. So we want to prevent the excesses that could lead to an expansion in the number of cases. So that's it for now. Again, happy 2021, a prosperous new year for all, and to the healthcare workers and frontline workers generally out there. The Jamaica Constabulary, who has done really well in trying to enforce during the Christmas season. I want to recognize them, recognize the minister who has worked very closely with us, or the ministers in national security. To all Jamaica, we wish for you a good 2021, and we will speak to you again in short order as we provide an update on COVID and the response. You were saying? Oh, you have another question. You told me to summarize. All right, fair enough. We'll do that quickly. Go ahead.
Just put this question. Dave from the Green says the new strain. The new strain of the virus has also been detected in parts of the U.S. How will the government respond in relation to travel protocols for travelers from places like Colorado and California?
Right. I just want to say that with the new variant, there is, first of all, no concrete evidence as to whether or not this virus causes increased transmission. We have seen reports coming out of the UK that would suggest that there is an increase up to 70% transmission rate with this new variant. But we really have no concrete virological studies that have proven that as yet. And that is why Jamaica remains cautious in terms of our approach. And so therefore we continue to have a restriction on the travel from the UK as we wait on the investigations to see. Now, we've had approximately, if you really check the literature, there are about 20 countries that would have reported that they have 1 or 2 cases, some 5 or 6 cases of this new UK variant. None of these countries have actually indicated that they have seen increased transmission that they think is due to this variant. And so that report is really only coming out of the UK so far. And so we continue to watch the situation and to observe what is happening. And, you know, we will always move to do our best to protect the population. However, we do not see any indication of any reports such as that right now. And the cases that are being reported are very few in these countries, in these almost 20 countries that have reported this new variant.
Sorry. Okay, so I think that's it. Thank you very much for coming online. Thanks to the media for helping us with the exposure. Thanks to the team again. And have a good Saturday afternoon and a good weekend. And please stay COVID-free. Thank you.
Healthcare workers are working very hard to ensure lives are saved and people recover quickly from COVID-19. But their work is becoming harder because you're not wearing your mask, washing your hands with soap and water, or using hand sanitizer, and you are not maintaining physical distance. Let's limit the need for hospital beds and ventilators. Do the right thing. Cover your nose and mouth with a mask. Practice good hand hygiene and maintain a physical distance of 6 feet between you and others. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness.